Well, hello, everybody, and welcome back to our Yerbba podcast. I'm Dr. Jennifer Griggs, a medical oncologist with a specialty in breast oncology, and I'm here today with Brittany Finley, who is an intuitive eating cancer specialist, dietitian, and we're just so pleased to have you here, Brittany. Thanks for joining us.
I'm so excited to talk with you today. Thank you for having me.
We're delighted. Why don't we start with you telling us a little bit about yourself, what you do, how you got here, and what lights you up these days?
So yes, a dietitian is my second career. I was in the Army, and back then I thought I could fix all my problems once I got out of the Army by going to nutrition school, but it turned out to be so much more than I ever expected. So my first job as a dietitian was in cancer, and it was so rewarding working with my patients every day that I really haven't strayed away from it. And it's what I want to do with the rest of my life. Now, I've had a few experiences that led me to intuitive eating, which is not necessarily the traditional paradigm in cancer care. But I've found that it really helps my patients a lot because it's about self care. And I want to be the biggest cheerleaders for my patients and help them help themselves. So,
Well, that's beautiful. It sounds like you had your own journey and came upon this style of practice and and originally right in the cancer realm. So you
yes,
landed within cancer and it just struck a chord with you.
definitely,
People think about dietitians, we think a lot about restriction, don't we?
for sure. Uh,
Yes.
And then, just to say more about my experience of what led me to intuitive eating, I remember as a young dietitian in oncology, I'd been a dietitian maybe 6 months, right? And as an oncology dietitian, you're not taught in school how to work as an oncology dietitian. You maybe get a week, right? So it's very rapid learning. But I had a scenario where I had clients that were on adriamycin, and there was two clients in particular that were really struggling with mouth sores and malnutrition, right? So at that time, sometimes we would give our clients parenteral feeding or feed them through their blood in rare occasions, but sometimes we would use that in our back pocket. And I had two clients that both were terrible. So I go upstairs and I talk to the doctor and I say, can we try this? Otherwise, I think our patient's going to end up in the hospital. And he said yes to one, but said no to the other. And I was really frustrated because I didn't understand why. And then he said, well, the one has weight to lose.
Hmm.
And I, I didn't have the verbiage or I didn't know how to handle that at that point. And I just said, this doesn't make sense to me. Her labs look worse. I think she's going to end up in the hospital. And sure enough, she ended up in the hospital. And later in my career, I learned that is a term called weight stigma and that a lot of our clients experience it. And it's something that I became passionate about. So once I learned about weight stigma, I learned about intuitive eating. So kind of went around the world, but this is how I got here. And I see it that it helps my patient because they feel less shame once we use something like intuitive eating.
So important. There's so much blaming and stigma attached to weight, and we make the assumption that people who weigh more than so-called ideal body weight, which was based on white men, and it was the average body mass index that then became the ideal.
Right.
But, as you know, we have this notion that if somebody weighs more than the quote ideal, that they don't need nourishment,
Right.
and it's a form of shaming and, like you say, stigma, and it's not good clinical care.
No, and it's definitely something that all of us healthcare workers have to learn about and deal with. It's something that we have to, you're never going to be perfect at it. I always tell my people once I teach about weight stigma, is this something we have to learn? We're going to fumble, so be humble. We're going to get there. You just have to try.
I love that. We're going to fumble, so be humble.
Right.
Yes. Well, what do you hope to do with your platform? You've mentioned a little bit, but I'd love you to go deeper into what you're hoping to do.
So currently I work one-on-one with clients during treatment and after treatment. And I use intuitive eating to help them go through treatment so they're more open to different types of foods. And then after treatment, really intuitive eating helps to not be so mad at your body. It helps you to be more gentle with yourself. So one of the creators, she says intuitive eating is self-care eating framework, which integrates instinct, emotion, and rational thought. So instead of shoulding yourself all day, every day about nutrients and what you think you should eat, instead we maybe focus on during treatment what you can tolerate. After treatment, what would you enjoy? What's going to nourish you? What's going to help you recover? So I love personally working one-on-one with clients. I am looking forward to in the next year or so doing more group sessions, especially for people who are survivors, just because it feels like a lot of times our survivors, it's like they go through treatment and then they're like, what do I do now?
Mhm.
So they go to the internet and they might find something that's not correct, right? Or something that might harm them. So my goal is to give anybody who has gone through the experience of cancer or is going through the experience of cancer support through that.
And there's something magical about the groups. First of all, it allows you to serve more people. And
Right.
there's also some magic that happens in the group setting, isn't there?
Right. It's
People find just somebody else so they don't feel so alone.
exactly.
Yeah. So you're providing both education content and also it sounds like some practice at how to sort of work this new way, which very few of us grew up with, right? There was that clean your plate when you're a
Right.
child. Even if you're not hungry, you have to have everything on your plate before you can have dessert.
Mm-hmm.
And then there's the restriction that people go through of starving themselves. And I'd love you to say more about we don't like to talk about what we don't want to see, but the way we eat now and the way we counsel people now. I'm a clinician, and we don't receive a lot of, as physicians, very much training at all in how to advise people about eating. And our profession is well known for fat phobia.
Right.
Physicians, even physicians who specialize in weight loss, have stigmatizing thoughts and beliefs. It's part of the whole moral economy that you get what you deserve, and that a lot of things that people do are a lack of willpower. Could you speak to that message?
For sure. So the thing that comes to mind automatically that I like to remind everybody that weight is not a behavior itself. Weight is not a behavior. Behaviors are behaviors. So things like increasing fruits and vegetables, going for a walk every day, consuming enough water, managing your stress, getting adequate sleep. Those have a more profound effect on your health than what that number on that scale is. The number on the scale is just data. Now, if I have somebody in treatment, as you know, I can use their weight as a data point saying, hey, they're losing too much weight too fast. They might miss treatment. And my goal is to make sure you don't miss treatment, right? So it's data, it's not moral. And we have to uncouple weight as a moral issue. It is not a moral issue. And it can be really difficult because it's learning a new language. Because, an example, if you think of a Disney villain, right? Maybe Ursula. She's lives in a larger body, right? So we're taught that all the time. Or they're less intelligent, somebody like Homer Simpson or Patrick Star. It seems silly, but you get that all day, every day. So instead, focus on behaviors and things that you can control and eat and treat yourself with self care and compassion. I think that's probably the biggest thing, and I think it can be really hard. I think this paradigm works with cancer patients because it helps us to not be so angry at our body or to work through the anger and emotion of our body. Because a lot of patients feel like their body has betrayed them, right?
Mhm.
And most of us, especially women, from a young age, once we feel out of control, the way we control is through diet. So trying to be curious and compassionate with yourself and really uncoupling weight from health. Weight is just data, just like height. Um, just to give another example, so there was one study done, and it showed that people who are taller have an increased risk of cancer, specifically, I think it was prostate and colon cancer, right? We don't go tell people you need to be shorter, right? And weight is just as complex, if not more complex than height. So uncoupling weight from health.
Such a powerful message to uncouple what's on the scale from other markers of health. We know that C reactive protein, which is a marker of inflammation, and insulin resistance, these things can be entirely normal. And many people who might weigh more than what we call an ideal body weight, that what people look like and what the number is on the scale doesn't really correlate with health. And a lot of people say, well, I'm just worried about their health when I counsel them to lose weight. We don't know what's going on in somebody's body in terms of markers of inflammation and markers of health, like cholesterol and all these other things that, go into our actuarial risk profiles. We don't know what somebody's blood pressure is based on their body size.
Right. And just to add to that is we don't know anybody's history with food. So if you have someone who lives with a larger body, it's possible they could struggle with the eating disorder. So us saying something about their weight or just assuming their habits could make it worse. We don't know people's behaviors unless we actually ask.
And we don't know what's driving them. And
No.
trauma can affect how we eat and how we self-soothe. There are a lot of things that happen in people's lives that we don't know about, and many of us are not qualified to sit with.
Right.
So I love this more. It's a more holistic approach to how to care for people.
I think so. I definitely think so.
So tell us a little bit more about intuitive eating. We know the word intuition, which is kind of our gut feeling, right? So
Mm-hmm.
tell me how that all plays out in terms of if people want to practice intuitive eating, what are the key principles?
So there's 10 overall principles, but once I think of intuitive eating, I think of learning to listen to your interoceptive awareness. So that's just a fancy way of saying of learning to listen to, trust, and use your body cues, right? So a lot of us don't know what our hunger cues are. We don't know what our full cues are. We're so distracted when we're eating. So this way of eating, this framework of eating, helps you to learn all of those things again and put them back into practice. So, like I said, there's 10 principles. And the first principle that we always have to talk about is rejecting the diet mentality. So, the diet mentality is kind of that should, I can only eat this, I can't eat this. It's going online and seeing what the next fad diet is. So it's rejecting those things and understanding that, this doesn't serve me. So I'm going to learn to trust my body again, which can be really hard. And I find that, our patients are susceptible to the diet mentality just because, like I said earlier, there's so much going on that they need to feel a sense of control, and dieting is usually most people's first way of controlling things, right? Um, so, you know, the second thing is honoring your hunger. So this is the second principle. I'm just going to briefly go over the 10 principles. So a lot of people think you can't do intuitive eating during cancer because how do I honor my hunger? I don't have any hunger cues. Well, I tell people how you honor your hunger during treatment is to honor your biological hunger. So what I mean by that is though you may not feel your normal hunger cues like your stomach growling or feeling super tired or things like that, we know that biologically your cells need nutrients, right? So your cells need food, water, and oxygen, all of them, right? So just like you would take care of something you love, I need you to take care of your cells. And how you're going to take care of your cells is by every 2 to 3 hours, I want you to give yourself a protein, a starch, and a fruit or vegetable. So something as simple as cheese, grapes, crackers. peanut butter and jelly sandwich and an apple, right? So honoring your hunger in that way. So that's the second principle. And then maybe after treatment, we can learn to honor your hunger in other ways by learning what your actual hunger cues are. The third principle is making peace with food. So this can be really hard because you want to be mad at food because it's put out so often that this food causes cancer, this food cures cancer, or I did everything right and why did I get cancer? I want to tell everybody here and now, scream it off the rooftop, that no one food causes or cures cancer, right? And no one meal is going to derail you. That's just not the way our body works. Our bodies are amazing, right? The fourth principle is challenging the food police. So, challenging those people who say, are you going to eat that? Could you eat that? Even if it's yourself. So giving yourself unconditional permission to eat what you want and trust yourself. And this can be really scary in the beginning because a lot of us are taught that if I have these Oreos in my house, I'm going to eat the whole bag. Well, in the first few weeks, you might. But what eventually happens is that it starts to taste less and less good because your body becomes less of a big deal. You're like, it's called habituation. It's not a big deal. It's there. You could care less. You know, because it's not restricted, that you could have it at any time. So that's something I work on with a lot of clients is habituating food and challenging their food police, like questioning where did you get these thoughts on food from, and are these thoughts of food serving you any purpose, or are they getting in the way of you eating? So if you're on treatment and somebody tells you you can't eat gluten, but the only thing you can tolerate is bread, is it serving you to not eat that bread, right? Another principle is respect your fullness. So during treatment, we don't focus on this one as much. We focus this more after treatment. But I do tell people, during treatment, you may be full quicker, so you eat smaller. And that's how you respect your fullness in that way. And then principle 6 is discovering your satisfaction factor. So in Japanese culture, they really focus on food being pleasurable and eating their food and embracing it and really taking their time and focusing on that food. And I work with clients on that too, because food is meant to be enjoyable, right? Food is connection. Once I think of home, I think of my mom's homemade food, right? Or I think of birthday cake. Food, it's okay that food is emotional, right? It's okay that food tastes good. And then the 7th principle is honor your feelings without using food. So everybody uses food as a way to deal with emotions, and that's okay. That's completely normal. But I don't want that to be the only tool you have in your toolbox, right? I don't want it to only be food that you pull out when you're feeling feelings. So we go over how to use other things like going for a walk, journaling, being a part of a group like we talked about earlier. And then the 8th principle is respect your body. Sometimes it's necessary that you work with a therapist to help with body image, right? Sometimes it's necessary for you to just be at peace with your body to really take care of it. And just remember that being mean to your body is not going to help you take care of it. All right. And then principle 9 is exercise, feel the difference. So it's joyful movement. Can you move your body in a way that brings you joy? Right? So if you're already going through chemo and you're feeling super lethargic, you don't have to go do a CrossFit workout, right? You can go for a walk. That's going to give you the benefit. Find ways to move that you enjoy. When was the last time you did something fun, like go roller skating or go for a hike, go for a swim? Can you make a movement about celebrating your body instead of changing your body? And then probably the principle that's most people think of once they think of a dietitian is honor your health with gentle nutrition. So gentle nutrition really combines what we call medical nutrition therapy with what you do every day. Okay. So for example, if I have someone who is having mouth sores, I will use gentle nutrition and say, hey, we need to increase your protein. This is where actual nutrition knowledge comes in and say, we can still use this nutrition knowledge and not be controlling with it, but say, hey, let's increase this protein. I think that's going to help with your mouth sores. Or maybe let's try switching with buttermilk. Food can help with those mouth sores. So that's where we combine nutrition science with taking care of yourself.
Mm.
And it's the last principle because we have to get rid of that diet mentality and all that other stuff to really take care of yourself. And take care of yourself with curiosity, not control. And I think that's one of the biggest things.
I love that. I think for our listeners, this may be revolutionary unless they're familiar with intuitive eating. So I just want to reflect back what I've heard, which is curiosity, self compassion, and some science.
Yes.
Some science, like we know that not one food is going to cause cancer. Restricting food is not going to prevent your cancer from coming back. And this honoring of your body, especially during extreme times of stress, when you're going through treatment, when your self-image is already battered because of hair loss or loss of your eyebrows and eyelashes, surgery on your body, parts that we consider part of our identity, there's already a battering of the body. And then our culture teaches us that food it's weaponized, weight is weaponized. And this feels so counterculture that it sounds delicious to me. There's so many things we don't do right in our culture. And I love the compassionate approach to our bodies, especially when we're going through something difficult.
Right. And I like to add that intuitive eating is an evidence-based practice. So there's not a ton of research on cancer patients specifically, but there are over 150 studies now on intuitive eating on things, especially like eating disorders with blood pressure, heart disease. So it is an evidence-based practice that was created by 2 dietitians. So it's not just completely countercultural, even though it feels that way, right?
Right. That's a really good point. Counterculture, meaning, our decades, really over a century of fat shaming and
sure.
Abolition of desire, especially for women. So I know that our women listeners, this may really resonate with them. And it's so important. Thank you for bringing that up, that this is evidence-based. Everything we do in Yerbba, we try to say, whether there's an evidence base or whether this is just good common sense. And this is to combine a bit of both. We know what doesn't work is shaming people. We know that doesn't bring out the best in people.
And it actually does the opposite of what we want to do. The shaming leads to more disordered eating patterns, more weight cycling. It's more increase in the C-reactive protein that you were talking about earlier. So restrictive eating does that. So
shame never brings out the best in people, is what I have found.
No.
Discernment can keep us from doing things we'll feel bad about later, but shame, that idea that I am a mistake, never brings out the best in people. So why are calories important? We view calories as the enemy, and restricting calories is what many of us were taught growing up is the way to maintain a healthy weight.
Right. So calories are just energy. So we make them into so much more than what they are. Our cells need energy to survive and thrive, right? And I think part of the problem is that we've been taught for so long that, the quote unquote normal amount of calories is 2,000. And that's just not really the case. During treatment, your caloric needs go up by a lot. So a lot of my patients, I hate to use numbers, but if I'm going to use numbers, they need anywhere from 4,000 to 5,000 calories just to not lose weight and to go through chemo. Chemo is tough on the body. Like, your body needs energy to get through this and to recover from this. So instead of thinking of calories as a negative thing, think of calories as energy for you to interact with your family, energy for you to be present and live your life. You need that energy, right? So calories are just that energy.
You've made them really neutral and actually positive, right? Because they're
Mm-hmm.
necessary for healing. We know restricting micronutrients makes it a lot harder to get through things where your cells are turning over rapidly, like they are
Right.
with chemotherapy. So the lining of the GI tract from the mouth all the way to the butt, our hair cells, our skin cells, everything that divides rapidly is affected by chemotherapy. I do want to say in people with breast cancer, people do gain weight, and I thought it would be worth, referring people to our other videos on Yerba on YouTube, and also to recognize that changes in activity, changes in sleep patterns are medications like corticosteroids to
Yeah.
prevent nausea, endocrine therapy, all the disruptions that happen in life can lead people to gain weight during treatment. A lot of people think that they'll lose weight during treatment. And so it can be, they feel like they're failing in some
Yeah.
ways. And it sounds like you would advise against that.
So this is kind of what bubbles up for me is that your weight gain is not a failure. It is a symptom of the things that you are going through. Your body is trying to survive, it's protecting itself, right? And it's not your lack of willpower in any way. So instead of trying to control your body like we talked about before, can you be compassionate with yourself and say, okay, my weight may be doing this right now, but I'm going to focus on those health behaviors that we talked about. Getting high nutrient dense food, moving more, managing my stress. I'm going to control what I actually can control. And again, that's not weight. Weight is not a behavior. I'm going to focus on caring for myself. And I think that can be really hard because sometimes I feel like I'm screaming into an abyss because what happens with a lot of my breast cancer patients is during treatment, they're told, don't lose weight, don't lose weight, don't lose weight, don't lose weight. And then treatment's over with. And then it switches to don't gain weight, don't gain weight, don't gain weight, don't gain weight. And they feel like they're all over the place. So instead, how can I nourish myself? How can I care for myself? How can I get to the next kind of step using compassion? I know I keep saying it over and over again, but how can I use the knowledge that my dietitians, my doctors give me, and my nurses give me and make it work for me? So, yeah.
Can you talk about the relationship between imperfection and intuitive eating?
So there's no such thing as a perfect diet. Um, it's just there's a good diet for you. Everybody is different, right? So finding what works for you, what works for your budget, taking that nutrition knowledge, that gentle nutrition knowledge of, okay, these nutrients may help fight cancer, like antioxidants and polyphenols. We know those can help fight. So can I get these frozen berries, right? Perfect doesn't exist. Do what works for you. And eating gives you that permission slip. I kind of think of it as this, I just give my patients this permission slip to eat what works for you and take care of yourself in that way. There's no such thing as perfect. So stop being so hard on yourself. And I know I've noticed a lot of our patients do have like they want to be quote unquote perfect and do everything correct. And there's
Oh,
no such thing.
yeah, there's a lot of pressure on people to be the perfect patient with
Yep.
cancer. They have to have the perfect mindset, they have to have the perfect emotional response, they have to manage every aspect of their behavior. There's a lot of should. You should do this, you should not do that.
So I'm from Georgia originally, and I had a grandmother who used to say, "Don't shit on me." And it just makes me think of that. Like, don't let someone shit on you because it's not going to help you. You get to make those decisions. And as we talked about, shame doesn't help at all. And it's really important, I think, during cancer treatment to feel your feelings, good, bad, positive, ugly, all of them. Feel the feelings. Best way is through. As Brene Brown says, one of my favorite people when it comes to emotion studies, you got to go through. And once you learn to go through or sit with those emotions, sit in the suck. If you guys are podcast people or Instagram people, I suggest you follow Body Image with Bree. He has a group for body grievers, and I think I've had a few patients work with her. She talks about sitting in the suck, and it's okay to sit in the suck and go through it. And you usually come out better on the other side.
Sitting with the suck. Yeah, cancer sucks.
Cancer sucks. It really does.
Not have to slap on a happy face or act like everything's okay is so liberating. And I think a lot of thoughts do get funneled through how we eat and how we feel about our bodies, restricting food and not listening to our bodies. This has been so helpful. Are there any other thoughts, anything that you haven't said that you are going to say later? Oh, I wish I'd said.
Oh, give yourself grace and advocate for yourself. And if you can't advocate for yourself, find somebody who can. I know there are plenty of healthcare professionals like me who are okay with having the conversation with family members that are trying to do too much, and I will advocate for you. So if you can't advocate for yourself, find someone who can and will advocate for you. I think it's super important. And find people. Like, you need people. You can't go through this alone. Those are my biggest suggestions. And yeah, so thank you so much for today.
Yeah, what a beautiful way to end. How can people find you if they want to see more about what you're doing?
Yeah, so they can find me on Instagram at brittanyfinley.rd. That's currently the easiest way to find me. And like I said, hopefully within the next 3 months, I will be starting groups. Other than that, I'm currently seeing one-on-one clients, and you can fill out the information and we'll go from there.
Wonderful. Well, thank you so much for coming on today. I've learned a lot, and I know that our listeners and our viewers have also learned a lot. We really appreciate your being here.
Thank you.